We go on with the great vessels in the retroperitoneum. Why is it so important and useful in clinical practice to be familiar with these structures? I remember a colleague of mine who called me after I performed an abdominal ultrasound of his patient, and he excused himself, telling me, "Sorry, Chris, Mr. X was not planned to undergo an abdominal scan. He's just in hospital because of hypertension." So here we see the abdominal aorta, and there's something wrong with it. And then the next clip, we see also the color Doppler. So there is a great abdominal aortic aneurysm. So I interrupted him and said, "Oh, this mistake maybe saved the life of this patient. The patient has an aneurysm of the abdominal aorta, size greater than 5 centimeters in diameter. So there is an indication for vascular repair to avoid a sudden rupture." We know mid-aged male patients with hypertension and smoking history are at risk of suffering from aortic aneurysms. What are the vessels we are going to scan? The abdominal aorta, of course, and its branches, the celiac trunk, and the superior mesenteric artery, so-called SMA, and the renal arteries and common iliac arteries. But there are also some veins which are very important, and we can use them as landmarks. So we have to look for the IVC, the inferior vena cava, portal vein, splenic vein, and the renal veins. When I started performing ultrasound examinations many years ago, I was overwhelmed by these plenty of vessels passing over and under the other, from the right to the left and the other way around. But keep in mind, this is hot stuff, quite puzzling at the beginning, but I promise it will become more clear and easy for you each time we repeat scanning this area. We start to identify the great landmarks, the abdominal aorta and the IVC. The abdominal aorta is situated in the midline of the patient, anterior to the spine, and follows a strict vertical course from cranial to caudal. Slightly right from the midline, we find the IVC, also parallel to the aorta. When we start performing ultrasound, we place the probe in the longitudinal way in the midline of the patient and try to identify the aorta and the IVC. Then we follow its course caudally and display aorta and IVC. First in a longitudinal scan and afterwards in a transverse view. Once we found the aorta, we can name the structures on the screen. We see the aorta over here, posterior to the aorta, the spine, anterior we see the left liver lobe in the near field, parts of the diaphragm, parts of the heart, and we can already detect 2 branches of the aorta directing towards the abdominal wall of the patient. So let's go for the video clip, and we can nicely see the pulsation of this great vessel. There's the stomach over here, also over here, the cardia of the stomach, and in this area we can see the pancreas. Right of the aorta, we scan the inferior vena cava in a vertical course too. According to the minor pressure in the vein, we can compress this vessel during the examination. The walls are barely seen and the pulsation shows a double pulse due to the motion of the heart. Its diameter also varies with inspiration. When the patient stops breathing, it increases in size. This is because the pressure in the thorax is elevated and the blood flow is stopped. We see the IVC on our ultrasound screen over here in a longitudinal direction, anterior to the spine and dorsal to the left liver lobe over here. We go on for the video clip, and now you can easily see the motion of this vessel is double pulse. Once again, a pulsating, tubular, echo-free structure, posterior to the left liver lobe and anterior to the spine. We can distinguish between aorta and IVC. We use them as landmarks in the retroperitoneum. We differentiate them apart by single pulse versus double pulse, the anatomic location, the wall thickness, and by changing of diameter during breath hold in the IVC. So I think we got it. Guess what you can see here? Is it the aorta or the IVC? We see double pulse, a thin wall, changing of diameter. It's the IVC. And over here, the aorta, single pulse, thick wall, and no changing of diameter. We proceed with the first branches of the aorta, the celiac trunk and the superior mesenteric artery. The celiac trunk trifurcates into common hepatic artery, splenic artery, and the third one, the left gastric artery, which is not regularly seen on an abdominal ultrasound. And the superior mesenteric artery, SMA, which follows the abdominal aorta in a vertical course, and the smaller branches of the SMA are not really seen on the abdominal scan regularly. You can see the course of the SMA parallel to the aorta, and the celiac trunk over here, a CT of a patient where we can detect these structures. Over here, the aorta, SMA, parallel to the aorta in its course, and the celiac trunk over here with one branch to the left side of the patient and one branch to the right side of the patient. You can take it more closely. Celiac trunk, splenic artery to the patient's left side, and common hepatic artery to the patient's right side. We have already seen this in the last picture. The first branch over here is celiac trunk, and only a small step inferior to the celiac trunk, the superior mesenteric artery originates from the aorta, follows a vertical course parallel to the abdominal aorta, and it looks like a pilgrim leaning on the aorta. When we change to the transverse view, it looks like this picture. We see the aorta, now in a transverse view, so it's round-shaped, dorsal to the aorta, the spine, and anterior to the aorta we see this round-shaped artery. It's the superior mesenteric artery. Even in the near field we can detect the liver and the pancreas. Once again, aorta, splenic trunk, celiac trunk over here. Once again, the aorta over here, celiac trunk, and more caudally, superior mesenteric artery over here. Both round-shaped because we are scanning in a transverse view. Another example for a very nice picture of the celiac trunk is seen over here. The aorta, celiac trunk, splenic artery to the left side of the patient, and common hepatic artery and its course to the liver on the right side. So where are the renal arteries? We need really perfect examination conditions to find them, so don't be disappointed when you don't depict them in an everyday scan. Over here, we can nicely see it, the aorta over here, and one branch to the right kidney, so we can follow the course of the right renal artery on this video clip. Over here is the aorta, and we can see the renal artery over here, which originates from the aorta. We proceed to the left renal artery, which originates from the abdominal aorta over here. And we can see only a short course to the left kidney over here. I will stop the video clip to show you once again the origin of the left renal artery in this area. Now we look for the veins of the upper abdomen, and we can detect the splenic vein over here, the renal vein over here, which drains the blood from the left kidney to the IVC, which is located over here. So we see in the video the aorta, the course of the left renal vein, the splenic vein more in the near field, and again the arteries we already know, abdominal aorta and supramesenteric artery. Once again, the splenic vein, it's a really important structure in the abdomen of the patient because we can locate the pancreas. When we found the splenic vein, we know pancreas is located anterior to the splenic vein. And again, we see over here splenic vein, renal vein, aorta, spine. Once again, in the video, over here, splenic vein, renal vein, and the IVC right side of the aorta.